1 in 8 women and 1 in 1,000 men will be diagnosed with breast cancer in their lifetime. This year in Alabama alone, they expect 4,500 new women to be diagnosed. And pretty much everyone knows someone whose life has been affected. But what's good news is that research is leading to better outcomes. We now have 3.8 million breast cancer survivors across the United States. And nowadays, 4 out of 5 women are conquering their breast cancer diagnosis, whereas 30 years ago, those numbers were reversed.
Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. So October is Breast Cancer Awareness Month, and today we're going to be talking about breast cancer and specifically research. In the last 3 decades, deaths from breast cancer have dramatically decreased, and there's lots of factors we know associated with that, including lots of new treatments, but all of those new treatments came from new and increasing amounts of research. Today, I'm excited to welcome my friend Beth Davis from the Breast Cancer Research Foundation of Alabama. This organization is unique because it's based in Alabama and funds research conducted in Alabama. It's just such an amazing example of local collaboration that leads to a global impact. And we might add that some of that research is happening at the Mitchell Cancer Institute, where I am based. Beth, welcome to The Cancering Show.
Thank you so much. I'm so excited to be here and to share some information about our organization.
Excellent. So tell us more about the BCRFA.
The BCRFA actually invests research. What makes us unique is we fund breast cancer research only in Alabama. So what we are raising here in Alabama stays in Alabama. Our most recent gift was $1.275 million that we invested last year in 24 research projects across the state of Alabama. And as you mentioned, some of those were at Mitchell. We had 3 last year at USA Mitchell.
That is really amazing. I mean, that's a huge amount of money being infused into the research that's going to help our patients. So what 7 institutions?
The 24 research projects that we invested in last year were at 7 different institutes across the state. There was the O'Neill Comprehensive Cancer Center at UAB in Birmingham. There was Auburn University, the University of Alabama, Surflux, which is in Birmingham, Alabama, Hudson Alpha Institute of Biotechnology in Huntsville, and then we also did research, of course, with y'all at Mitchell and then at Tuskegee University. So really, we are funding top to bottom all the way across the state with our research.
That really is amazing. Tell us about what your goals are for 2023.
This year, we are hoping, we're always trying to do more because we know that research saves lives. So this year's goal is $1.3 million. And it takes money for us to be able to invest in research across the state. And we raise money through a variety of ways. We do special events. Our office, our headquarters is up in Birmingham. Right now, that's the only location where we are. But we're increasingly trying to raise awareness for what we're doing and develop further relationships with researchers across the state. But we do special events in the Birmingham area. We also have corporate sponsorships, individual donations. One thing I want to give a shout out for is our breast cancer research specialty license plates. That is the gray one with the pink ribbon on it. And last year, that tag, which is $50 added onto your registration, that tag raised over $600,000. And that is amazing. And we invested all in research projects.
That is amazing. And it is so great to know that investment in your $50 is staying in Alabama. I think that means a lot to people.
It really is amazing. And that's something that anybody can do across the state. Just go to your local DMV and just ask for the breast cancer research tag. And you can be a roving billboard to raising funds for research.
I love it. It's a great way to honor somebody that is fighting breast cancer or the memory of someone. Tell us more about breast cancer in Alabama specifically.
Well, 1 in 8 women and 1 in 1,000 men will be diagnosed with breast cancer in their lifetime. This year in Alabama alone, they expect 4,500 new women to be diagnosed. And pretty much everyone knows someone whose life has been affected. But what's good news is that research is leading to better outcomes. We now have 3.8 million breast cancer survivors across the United States. And nowadays, 4 out of 5 women are conquering their breast cancer diagnosis, whereas 30 years ago, those numbers were reversed. And that is because of treatment options, prevention tools, and of course, diagnostic tools. I mean, so many more. There are so much greater tools to diagnose cancer. There is genetic screenings that you can do. It's open and out there for people to realize that telling your doctor of family history, sharing the information so you can determine your risk factors and what time to start your screenings and things like that. That is so important. And, 30 years ago, people didn't speak about that as freely.
Yeah, no, that is such an important point. And I'm going to refer our listeners back to episode 21 with Cassie Gerganis, a genetics counselor who goes into great detail about who and why you might want to receive genetics counseling and why it's always important to know your family history. And you mentioned early detection, which my role in cancer control and prevention is just such an important goal for us to get the word out that not only, getting your mammograms on time, and if you have a genetic risk factor, getting additional testing if that's indicated with MRI, if you're known to have dense breast, getting additional testing with ultrasound, kind of getting the right test for you, I think is so important. And also want to refer our listeners to the Alabama Breast and Cervical Early Detection Program at www.alabamapublichealth.gov. So our state and almost every state in the country have programs for offering not just free mammograms, but also free diagnostic testing, follow-up testing, and free treatment that people who are uninsured or underinsured can get Medicaid to be able to pay for any cancer treatments. We would never send people to get a test that we could not also offer them the treatment for if a cancer was diagnosed. So proud of that program. And yet, and I'm sure you hear this too, Beth, that not enough people know about it, that it is something that we know that exists. Of course, we want to encourage people to advocate for improving funding to that program, but is too often overlooked. And I'm sure you hear this also. Women are diagnosed with breast cancer who maybe missed a mammogram or two because they changed jobs or didn't have insurance and didn't think that they could afford to go.
Absolutely. I think awareness of that program is critical. And there's something going on in Congress and in the Senate right now that is also, because for people that do have insurance, sometimes the barrier is copays. And so right now there is in the Senate, the Breast Cancer Diagnosis Act, and that is trying to, right now through the Affordable Care Act, your screening mammograms are fully covered. There's no copay if you're insured. But if there is a result on that warranting diagnostic screen, sometimes there are copays depending on what insurance you have. And so this act is trying to encourage people to require that there be no copays if you have insurance and, find something that needs further testing. So that then opens the door for more affordable options for people that do have insurance that wouldn't be covered through this other program. And there's also another bill in the House right now that is for the Multi-Cancer Early Detection Screening Coverage Act, which is looking at blood screenings. A lot of blood tests can detect various types of cancer. So that they're encouraging that to be covered, which would then translate to multiple cancers versus breast cancer. So that's exciting. I mean, I think there are a lot of advances being made in this area, which is just another improvement and cause for hope in this space.
Right. And I love that you've made that connection, and we've really tried to bring our listeners to that space as well, that connection between advocacy and policy change that leads to real boots on the ground, more people getting tested, more people getting diagnosed, more people getting treated early, and more lives saved. So, and it is the advocacy component is really making sure that the research that has discovered something new, whether that is the, blood test for cancer diagnosis or a new treatment, you really need that advocacy to get that discovery to the bedside as quickly as possible. There's some research that shows that on average, it takes 20 years for a new discovery that's been proven to work to get to the most rural areas of America.
Absolutely.
So love the work that you guys are doing to improve that advocacy as well, to really, be that go between the researcher, the patient, and the clinical team, because too often those three groups are so busy fighting the cancer that they don't have enough time to fight for it. And the work that you do is just so incredible from that standpoint as well.
Thank you very much. We're happy to lean in on that space as well, because it's important. You're right. It all goes together and can make dramatic improvements.
Talk about Alabama's unique challenges with breast cancer.
Well, in Alabama, there's different cases. Access to care is not always equal. Awareness about screening guidelines is not always equal. And so that is really why our co-founders started the organization in 1996. It was Dolly O'Neill and Bruce Sokol. They were two Birmingham residents whose lives had been touched by breast cancer. And they decided that investing in research was the best way to improve outcomes for generations to come. So they did a golf tournament. They netted through local support and community and corporate supporters. They netted $68,000 right out of the gate and decided that they should keep doing it. And so our organization was formed. The Breast Cancer Research Foundation of Alabama was started in 1996. And since that time, we've invested $14 million in life-saving research.
I mean, that is just an incredible figure for a single organization that doesn't have a national presence. It's amazing to think about the amount of research to come out of that.
And really, our research that we do is seed money, is what I like to call it. We ask you to bring us your great ideas, and we provide 2-year grants at $50,000 a year. And so really what we're trying to do is help researchers get the data necessary to go after the national and federal funders. So for the National Institutes of Health and for NCI and DOD, all of those multi-million dollars grants that you can receive, our grants at the local level helps bring those dollars to Alabama as well and helps the researchers submit successful applications to the bigger grants.
Yeah, no, it's so necessary, right? And promoting junior scholarly activity, from our faculty who are just entering the field of research, and then have them go on to be, famous in their field in future breast cancer research and to make a national impact. I think it's just so amazing.
We do too.
Talk about some of the successes that you've seen in the past as a result of the Breast Cancer Research Foundation investment.
Well, we've had drugs that we have helped develop. Our co-founder, actually, Dolly O'Neill, was actually treated at a future time with a recurrence with one of the drugs that we actually helped put research towards. So that was a full circle moment for the organization. We have also had researchers successfully get those NIH and NCI and DoD grants, the average return on investment from a dollar invested is about 14 to 1 through the leverage of getting those national grants back to our investment. So if you take our 14 times 14, I'm not a mathematician, but it's approaching $200 million of impact.
I mean, I think that's exactly what we want to hear, that it's a huge leverage up and really gives people that extra push that they need to get investments from the federal government that result in those big clinical trials and everything that help Ms. O'Neill. That's amazing. So talk to us about some of the research that's currently being funded by the BCRFA.
Well, right now we are supporting a collaboration between Auburn and Alabama that is aimed at solving, drug resistance. Sometimes cancer cells can become resistant to a certain type of treatment, and they're looking at things that they can do to make those treatment options work again. So that's something that we're supporting. There is a researcher at UAB that is working on triple negative breast cancer. We're actually supporting several triple negative breast cancer projects because that's a challenging area. But one of the things that they are doing at UAB right now is that looking at toxicity and what levels, to minimize the effects from some treatment options while still maximizing the benefit. So they're looking at that.
And, by toxicity, talking about the side effects that patients experience. And, too often for us as treating physicians, we want to continue the patient on the treatment. The treatment might even be working. But if the side effects are so severe that they really impact a patient's lifestyle or even, make it so that they can't leave the house, they feel so sick all the time, then the treatment's not worth it. So being able to minimize that toxicity on the patient while still being maximally toxic on the cancer cells is a huge way to benefit patients and kill more cancer.
Absolutely. And we've actually looked at some survivorship research, looking at timing of different treatment options, as well as identifying patients who might be at the highest risk based on the historical data. When you have 3.8 million breast cancer survivors across the United States now, it's a time of using AI and crunching all the data that's out there to ultimately improve outcomes, and minimize toxicity and the negative side effects of treatment, which are, saving lives at the same time. So that is another project that we've been doing. And then at Tuskegee, we're looking at some differences between breast cancer, how it affects different people of different ethnicities and African American women. There's a researcher that's comparing the genes and molecules and proteins in cancer cells from African American and Nigerian women and comparing the similarities and the differences to ultimately provide better outcomes.
I think that's amazing. And, you talked earlier about the disparities that we see in Alabama. And, we think that one of them really is the stress of being an African American in America. And there are some other research in other cancers that speak to this difference between women in Africa and women who are African American, and how those differences, including stress, cortisol levels, changes in the way our immune systems respond, that really could make a big difference, not just in breast cancer, but beyond.
Absolutely. And we are actually funding 3 projects right now at Mitchell. And one of those from Seema Singh actually speaks to that and is looking at the exposure to stress and how that shapes tumor immune microenvironment and the way the types of immune cells of breast cancer and where they are located within the tumor. So she's analyzing some of those stressors and how they impact response in a body. Debanjan Chakraborty's project, also at Mitchell, is looking to establish a molecular link between hypertension and breast cancer projection, and looking at Wnt inhibitors, and which are proteins. And I'm not a researcher nor a scientist, so that's about my level of understanding. But what's great is that these researchers are doing great things, and they have the minds and the capability. We've got one more at Mitchell right now, which is Luis Del Pozo Yane's research that focuses also on triple negative breast cancer. And he's looking at the polyploid giant cancer cells that overexpress a protein known as PERK that promotes chemo resistance. So again, they're looking at ways to make, your body respond to and accept the chemo, and then help activate it if it stopped working. So it's an exciting time in research. And what's really important is that's going to save lives.
Yeah, absolutely. And not just Alabamian lives, but lives of folks all over the country with this research, that goes on to federal funding or clinical trial. I love the story of Miss O'Neill benefiting from a drug that was developed right here in Alabama that her foundation helped to fund. I mean, what an amazing statement of how that progress saves lives. So looking ahead, how do you see the foundation growing and evolving alongside the research?
Ultimately, our goal is to put ourselves out of jobs. We would love to have cancer be no longer a public health crisis, so we want to keep fueling the best research across our state. I mentioned that we're always trying to raise more. This year's goal is $1.3 million across the state, which would be a record high for us. When I came to the foundation in 2014, we had invested $500,000. So we've far exceeded that, and we're keeping going. So that is a goal, and really, I'm really actively trying to, when our foundation started, we were first investing in research at UAB and exclusively at UAB. And since I've been at the foundation, we've broadened out, and I am actively trying to engage researchers from across the state to realize that we are a resource to fuel their good ideas, so awareness is what I'm trying to do, which will ultimately help us raise more funds to invest in more research. And at the end of the day, we're trying to save lives. So that's our big goal.
Well, it seems like you're most of the way there. Congratulations. It's amazing what you've accomplished in such a short time.
Thank you very much.
Beth, for our researchers out there, tell us more about the application process.
Each year, we hold a request for proposals cycle. It begins August 1st, and proposals are due by October 1st, or like this year, October 1st was a Sunday, so we made it October 2nd. But it's a simple application, and we put our RFP on our website so that people can review it and see what's needed. It's a simple application process. They send proposals to me, but I am not the reviewer. We have a medical advisory council and Seema Singh from USA Mitchell is on that council. And so we have experts that will review the proposals and score them like they would like NIH reviews. And so our researchers get notes, there's different criterias, and then we can see how many projects that we can fund based on the amount of funds we raise during the year. And we're going to fund as many as possible. So we typically fund down to about 6 weeks of operating for the next year. So we go deep and hard and fuel as much research as we can. But people that support the BCRFA can be confident that they are funding the best research because we have experts in the field that have also received federal grants and received, significant researchers who know the science reviewing the proposals, so the dollars are put to good use.
So, Beth, we've talked about researchers applying for funding and also volunteers, people who are interested in your events, or other folks who would like to contribute. How do people get in touch with the Breast Cancer Research Foundation of Alabama?
Well, they can find us on social at BCRF Alabama. So we're on LinkedIn, Instagram, Facebook, and what's Twitter's new name? X. And then you can go to visit our website, which is BCRFA.org. So it's Breast Cancer Research Foundation of Alabama, BCRFA.org. And you can find out about the research that we're supporting. You know, we have a list of all the projects and a quick summary of all the 24 projects that we're supporting right now. We have a list of different ways you can get involved, you know, and there's just all of our event calendars up there. It's just a lot of great information, and we'd love to engage.
Excellent. I have so enjoyed our conversation today, Beth. Thank you again for joining us and letting our listeners know more about the BCRFA and all the work that you do. It's really impressive.
Thank you very much. I appreciate you having me on.
So for Breast Cancer Awareness Month, I was so excited to bring you this interview with Beth Davis of the Breast Cancer Research Foundation of Alabama. It's just another piece of the puzzle when we talk about cancering, how any of us can be part of that, donating, volunteering, in survivorship, those doing research, and of course, all the patients, providers, and caregivers out there. And, you know, too often we get bogged down in the day-to-day of taking care of patients and fighting cancer. And I just love that ongoing message of hope, that there's research being done every day here in Alabama and around the world to fight cancer stronger and harder and do better to create more survivors in this world. Again, thank you so much for listening to our show today. Until next time, keep cancering and take care of yourselves. Thanks again for listening. And don't forget to submit your questions at www.cancering.com. We're here for all of those questions and we'll get you the answers. This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond, with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.